Hello, I'm Ruth Williams Hennessy, and this is a demonstration of what I call my all over the head, outside and inside release techniques through massage, particularly for the voice. So for those of you who were at the Voice Foundation Symposium in 2014 and missed this very last bit of my workshop, this is particularly for you, but also for anyone else who finds it helpful. So we're going to release the head manually. So the first thing I want you to do is make a fist so you have knuckles, and you're just going to massage with your knuckles all over your head. So at the base of the skull, over the ears, in the temples, all over. And one of the reasons that we use the knuckles is so your fingers don't get caught in your hair. It also gives a nice pressure, but don't beat yourself up. The next thing that we're going to do, and I'm going to take off my glasses to do this, is we're going to release a muscle called the temporalis. So the temporalis is a clam-shaped muscle that comes over your head here at the temple, and it actually inserts into the jaw hinge. So a lot of us are massaging the masseters to release the jaw, and that's great, and I applaud that. But the truth is that if your temporalis is short and tight, it can be hiking that lower jaw up into the jaw hinge with tension. And no matter how much you release down here, you're really not able to release the jaw at the hinge so that it can just fall away from the head. So we're going to use the same knuckle technique on the temporalis. And here, you just want to go back and forth across this area. If you're particularly tense there, it can be a good idea to do one side at a time so that you can really give it your full attention, all the way up to the top of the skull and then all the way down into the jaw hinge itself. And you may be very tender here. This is probably a place you have not massaged before. So you want to give both sides a nice release. After you've released the temporalis, then I like to follow up by massaging it again with the fingers, coming down into that jaw hinge, putting your finger there in that space where the condyle is, feeling that slight indentation, opening your jaw, and releasing in the back of the neck so that as you open the jaw, that space that your finger is in doesn't change considerably. If you push the jaw forward, you'll feel that the shape of that space change. If you push it down with tension, same thing. If you just let it fall back, the shape of that indentation does not change dramatically. So we're going to release the masseters. That's a muscle that attaches the lower jaw to the skull here at the cheekbone. So it's kind of a wide muscle, and it's on the outside of the bones, so it's easy for you to feel with your fingers. Ideally, I would like for you to be able to press through the masseter pretty easily and feel your individual teeth. If the masseter muscle is thick and tight, and you're shortening it in your usage, then it will be much harder to feel your teeth. And so massaging here is a great thing to do on the outside. And then what I want you to do is come here to the point of the jaw. So here's the vertical jawbone, and then the jawbone coming this way. And so we're going to come right here to the point, kind of come behind there and up and in. And again, I would do one side at a time. And so you're coming up in underneath that jawbone into the pterygoid. And this may be very tender for a lot of people. You're probably not used to massaging here. It also may be kind of connected to your sternocleidomastoid muscle. And so you want to try to make space all around there so that the pterygoid is not glued to the neck, but actually able to function inside the skull and jaw for opening and closing the mouth. And then you want to do the other side. Same way, just kind of come up and in. It's probably easiest to do it with your thumb. Just releasing that tension, trying to create a little length and release. and space in between that muscle and the bone, so that you could get your finger in there. And again, in between that muscle and the sternocleidomastoid. And then just follow that around on the jawline. What you feel under here, these are tongue muscles. They're connected to what we think of as the tongue, the blade of the tongue. And so you want to feel here on the underside of the jawbone how all of those muscles, many of those muscles are connected here. And you want to release them away from the jawbone. We want the tongue and lower jaw to be able to work independently of each other. And if they're really glued here, if the muscles are really glued at the bone, then every time you release your jaw back, the tongue has to follow, and it's difficult for the tongue to come forward into the mouth to say the words. So then you can come and kind of freestyle with your thumb underneath here. This is still releasing tongue tension, and it's a wonderful thing to do every day, certainly. And though that's the end of the massaging outside, the next thing we're going to do is we're going to go inside the mouth and massage. So I'm using finger cots. You can buy these at your drugstore or on Amazon. If your hands are clean, there's no reason not to use your bare finger. But some people do have an adverse reaction inside their mouth to the oil in their own skin. So play around with that and see how it works. These are latex finger cots. I don't have a latex sensitivity. If you do, then you need to find, it's not that hard to find non-latex finger cots or even gloves. All right, so the first thing we're going to do inside is we're going to come outside the teeth, but inside the upper lip, and you want to go straight up into where, at the top of the gum. And so you're just going to go slowly. It's surprising how much tension people can carry here. We don't think of this as a place to massage, but very often people find a tremendous amount of tension here. So be gentle. And then we're going to do the same thing on the bottom, again, going straight down, not sideways here, but straight down. I always say when you're releasing a muscle, on a scale of 1 to 10, with 1 being almost no pain as you are releasing it, and 10 being yikes, you want to be at about a 3 or a 4. Higher than that is not more helpful. You want the muscle to be uncomfortable enough that it will release, but not so much in pain that it seizes up to protect itself. You don't get any real release that way. Most people are more tense here in the lower jaw than they are in the upper teeth. So take your time, again, going straight up and down, releasing that muscle. Then, in that same spot, now, instead of up and down, we are going to go sideways here, inside here. So you're outside the teeth, inside the skin, and you're going to slide along that lower jaw. This will be very painful for some of you, but remember, it's the first time you've ever massaged inside your mouth. So every time you do it, it should get less problematic. And again, take it easy. Slow and steady wins the race. So you're going to come back this way until you hit muscle, and that's your masseter. And at that point, I kind of like to make a masseter sandwich and massage from the inside and the outside simultaneously. So I'm inside the muscle, and then I'm outside the muscle. You can do this with your thumb on the inside and a finger on the outside. That can be kind of an intense massage. Take it easy. And so you just want to massage that muscle as much as you can, get as much release as you can there. And then you want to do the other side. So you'll do the same thing on the other side. Slide that finger back until you hit muscle. Then your thumb on the outside, or you can use your other hand on the outside. Massaging the masseter. Then I want you to take your index finger, and this time, instead of the pad of your flesh sliding along the bone, I want you to use the side of your fingernail sliding along the bone. If you happen to have long fingernails and you use a finger cot, you can just put a little ball of cotton at the inside the finger cot before you unroll it, and that'll protect your from poking yourself with a sharp fingernail. So fingernail against the teeth this time, against the bone, and now you're going to slide along there. But when you get to that masseter, now we're going to slide up the vertical jawbone. So pad of your flesh against the flesh of your cheek, fingernail against the vertical jawbone, and you're just trying to slide that masseter, and you'll feel clumpy tension in here and fascia. And so just gently poke around in there and try to get rid of the clumps of tension that you are probably feeling. Slide up and down, releasing that muscle away from the bone. This is also a great exercise to do while you're vocalizing. So if you're creating tension here in order to achieve the pitch or a certain volume, then you'll recognize it, you'll feel it, and you get that instant biofeedback about what you're doing as you're singing. So you're going to slide up that vertical jawbone and then flip your hand around and come up into the cheekbone. So ideally, you'd be able to just slide up there with no resistance from tension or fascia. Most of you, probably that will take some time before you're that released. You just haven't been in here releasing it ever, so how could it possibly not have become tense? And after you've released that side, then take a moment, take your finger out, and you'll feel how much longer and released the side that you worked on feels than the other side. And for many of you, it will be visible. If you take a moment and look in the mirror at this point, you'll see that now your face is asymmetrical because you've lengthened and released the masseter so much, your face is actually longer. So then we're going to do the other side, same way, fingernail against the lower teeth, against the bone, come back to the masseter, slide up with your fingernail against the vertical jawbone, slide up, releasing that masseter and all the clumpy tension, lifting it up and away from the bone. With apologies to my vegan friends, if you've ever boned a chicken trying to take the chicken breast off the bone, this is a very similar activity. Slide up that muscle until you get to the vertical jaw, to the zygomatic arch in the cheekbone, and you want to massage in there as well. Once you've finished that release of the jaw, there's another jaw release I'd like to show you. So you're going to take your thumb and slide it along your lower teeth until you come back to that vertical jawbone. So one thumb's going to be inside that vertical jawbone. The other one is going to be on the outside. You can lace your fingers together if you like. And you're just kind of gently pressing your thumbs against the inside and outside of that bone, and kind of coaxing the lower jaw out of the jaw hinge. Again, be very gentle, slow and steady will get you the release that you're looking for. Here, you're again on that pterygoid. This one will probably be an intense sensation for many of you in the beginning. But as you continue to do it on a daily basis, then eventually it's not problematic at all. It's just a nice release and a way to check in to see if any of the activities that you're currently doing in your phonation, speaking or singing, whatever you're doing, is creating jaw tension. The next thing we're going to release is the tongue from the inside. Now, we did some out here. Remember, we came along that jawbone on the outside. Now we're going to do the same thing, sliding along that jawbone, but inside the bone, inside the teeth. So take your finger and put it inside the lower teeth, and right in the center there where the frenulum connects to the jawbone, where your tongue, that little piece attaches it to the jawbone, right under here in that spot, people have like a little ball of tension. So you want to attend to that first. And again, this painful spot, gentle and careful. So just massage that little ball of tension, releasing it. Take as much time as you need to. Then you're going to slide your finger past that toward the back of your head, going down as deeply as you can. Again, 3 or 4, not a 10. Pressing down on that muscle and going all the way back, if you can, as far down as you can, and as far back as you can. And again, take some time to feel how that side feels different than the other, and then go in and do the same thing on the other side, pressing your finger down as far as you can, not as far as you can't, and then keeping the finger moving down as you follow that jawbone back toward the back of the head. So that's a great way to release the tongue away from its attachment to the lower jaw. Then you can come in under the blade of the tongue, here, 1 finger, 2 finger, and again, now you can we made a masseter sandwich before, now we can make a tongue sandwich. You can put a thumb or a finger on the outside, 1 on the inside, and when you find those little clumps of tension that have simply never been released before, then gently you're coaxing that tension from 2 sides. If that's too intense for you, do 1 side and then the other. Nothing wrong with that. And so you can just kind of freestyle in that whole space under your tongue. None of that should be tight and painful and clumped up. All of it should be released and long and supple. So take as long as it takes for you to do that. Sometimes I like to take 2 fingers and kind of lift up on the tongue to release it. We can palpate our laryngeal position, fold the tongue into the well behind the lower teeth, and see how far we can easily stretch the tongue forward before the larynx has to follow, how much flexibility we have here in these muscles, that the tongue can really move forward without hiking the larynx along with it. And now, this is the part where it gets a little weird. I know you thought it was weird already, but now we're coming to the part that maybe, it's something you haven't thought about before. So you can go on your hard palate and massage the hard palate, even though you're not going to get obviously much movement there because of the bone. When the bone ends and we come to the place that we call the soft palate, your gag reflex may become involved. I think that vocalists do very well to conquer the gag reflex. That might sound a bit extreme, but the one thing all vocologists agree on, every voice teacher, everyone agrees the throat should be open. So gagging is closing that throat. If we can begin to control that action, you just have to promise not to swallow any large objects while you're singing. So we're going to try to conquer that gag reflex a little bit, and we're going to take 1 finger and massage the soft palate. And so you can go from side to side. You can go as far back as you can. And what you want to feel again is suppleness. You want to feel that the muscle can stretch and respond to whatever instruction you want to give it. Some people like to take 2 fingers and start at the center of the soft palate and stretch it wide with the 2 fingers like this. Again, that's kind of an intense stretch, so you might have to work your way up to that. Now, I promise this is the strangest thing we will do in the whole clip. I want you to follow the muscle in that soft palate. I want you to follow it as it comes down through those arches that we see in the back of our throat. 1 pair of arches attaches to the tongue, the palate glossus. There's a little membrane that you'll feel if you get all the way down to the bottom. I feel that flexibility in the soft palate and the tongue, especially the way it attaches to the hyoid bone and then the larynx underneath there, and so the back of the tongue, the arches, which are just a continuation of the soft palate, they're not even really separate from it. Flexibility in those areas is crucial to me, especially for high notes. So especially if you're a classical singer and you want the larynx low, the tongue to be able to come forward and say the words, and the soft palate to stretch, if those arches, the muscles there, the palatoglossus, are short and tight, you simply don't have the flexibility to accomplish that. So massaging there, while it seems strange, I know, can be very instructive, again, especially while you're singing, and particularly for high notes. So just gently, again, do what you can, not what you can't. Some of you will be able to sail all the way down that palatoglossus, there behind the tongue. That will be released already for you, and that's great. For those of you that have a much harder time and the gag reflex kicks in, just do what you can, not what you can't. Be patient with yourself. I have a Broadway singer who said to me once, he said, "Ruth, you know, the first time you went into my mouth, I thought that was the strangest thing I had ever seen." And he said, then I thought, I get a massage every week for my legs because those are the muscles I use to dance with. So why wouldn't I want to massage the muscles I use to sing? So again, this can, as you're massaging them for release, I would do one side at a time. If you're going in there to feel what's going on as you sing, sometimes those muscles are actually squeezing together as someone goes to a high note. That, again, that instant biofeedback is so valuable for anybody who uses their voice. So that is the end of the inside and outside the head massage release technique. If on your own you want to quantify the efficacy of these maneuvers, then you can do some vocalizing and breathing before you do the release, and then do some vocalizing and breathing after you do the release. I will be very surprised if you don't notice a difference. And I'll also be surprised if you don't find it a helpful thing to do while you're singing. So please let me know if this was helpful for you, and if you have any questions at all about this clip or about any of my workshops. Thank you.